Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years of experience, here to talk to you about the Medicare weight loss coverage program that'll start soon, on July 1st of 2026. We'll go over who qualifies for this program with a BMI of 27 or greater. So the Medicare GLP-1 bridge program will be starting soon, and many of our Medicare patients will qualify for it. They must be 18 years of older, and they must also be maintaining on a lifestyle intervention program with nutrition intervention and physical activity and exercise. That should be ongoing. If their BMI is 27 or greater, they will qualify if they have one of several conditions. So first, just a little bit of background on the BMI, or the body mass index, which is used by plugging in a height and a weight and coming up with a number. Uh, Usually above 30 is considered obese, above 25 is considered overweight, and 18 to 25 is considered to be a healthy BMI. A BMI may not measure fitness or fat mass or muscle mass, but it does give us a number which has been uniformly used in various studies, because some criteria has to be set to establish what medications and what levels will be appropriate across populations. So just to give you an idea, what is a BMI of 27? Well, for a person who's 5 foot tall, that would be about 140 pounds. For a person who's 5 foot 8 inches tall, that'll be about 180 pounds. So as you can see, there'll be many people who may qualify for the medications under the new Medicare program with a BMI of 27. So what are the medical conditions that you need to have in addition to that BMI of 27? Well, the first is you can have prediabetes as defined by the American Diabetes Association definition. This is one that may be easy to prove because it's a blood test. If a fasting blood sugar is 100 to 125, that is prediabetes. If an A1C test is 5.7 to 6.4%, that is prediabetes. There's also criteria based on a glucose tolerance test, but there's really no reason to do that when you can just measure one blood test on a visit, including a fasting sugar and an A1C. So that criteria will be the first criteria. The next criteria would be evidence of a previous myocardial infarction or a heart attack. That evidence should be documented in the chart. Perhaps it'll be from an EKG or maybe by a patient's history, but evidence of a heart attack. The next group will include those with a BMI of 27 and greater who have had a previous stroke. And that also is going to be based on chart documentation. That's kind of an interesting topic as well, because as some of us know, a stroke can be very devastating, leaving patients with permanent issues. But if one did imaging of the brain, like a CAT scan or an MRI, evidence of previous strokes may be seen, even though that patient may not be left with residual difficulties and deficits. So it's unclear to me what that criteria will be moving forward for the Medicare program, but right now the criteria is named as having had a previous stroke. The fourth criteria will be having symptomatic PAD, or peripheral arterial disease. Mostly we know peripheral arterial disease as having poor blood flow to the lower extremities, to the legs, often manifested by a squeezing of the calf muscles upon walking or climbing steps, fatigue to the leg as well, pain to the leg, or an unusual feeling to the lower extremities, mostly the calf muscles or even the feet, upon walking. And the hallmark of this is that upon rest, those symptoms improve. So it's again symptomatic PAD, especially with exertional levels. There are tests that can measure PAD, something like an ankle brachial index or different types of angiograms, but it appears that the Medicare criteria for the weight loss medication is going to be symptomatic peripheral arterial disease. So in summary, patients who have a BMI of 27 or greater must meet one of four conditions: prediabetes, usually by a blood test; prior history of a heart attack, usually by history; prior history of a stroke, usually by history; and symptomatic peripheral arterial disease. Any one of those criteria will be appropriate.